Yeah, we can see it now.
Okay, perfect.
And just before we start, as a last mention, we are recording this session and it'll be available for everyone to review. También para acordarles que esta sesión está siendo grabada, por si la quieren ver después. Okay. Dr. Hernandez, it's all you now.
Okay, wonderful. Welcome, everyone. Thank you for being here with us. Today, we are starting our fourth Global Virtual Exchange meeting, and we are focusing today on a global health conversation. And today we will talk about really taking an opportunity to look at building the business case to address global health issues. And we will talk a little bit about our idea of the shark's den. And so on behalf of all our faculty here, I'd like to welcome everyone, welcome all the universities that are here and our students. Go to the next slide. Perfect. Okay, so basically, this is our welcome. We have our three regions represented, and just give you a little background on how we came about to develop Shark's Den. Cómo fue que empezamos y dividimos a Shark's Den. So first, you guys have all heard of Shark's Tank. Primero, todos han oído del programa del Shark's Tank. Es un programa que se enfoca en mover propósitos de mercado, para hacer y aumentar, what's the word for business?
Negocios.
Negocios. Un programa Shark Tank que empezó en los Estados Unidos, y también tenemos otro programa, se llama Dragon's Den, que empezó en el Reino Unido, y entre la combinación de los dos hemos llegado a Shark's Den. So Shark's Tank, that we are familiar with from the US perspective, really focused on proposing business cases and return of investments and increasing business and monetary outcomes. And in the UK, in that region, there's a program called Dragon's Den. So with a very similar focus. So we combined the two. So faculty got together and we said, we're going to create this Shark's Den. And so today is the first inaugural episode of Shark's Den. And we will have the medical Exeter students present their business case to address global health issues. So if you go on to the next slide, we'll kind of talk a little bit about how we see this happening. So if it's okay, Jesse, can you go to the next slide? And the next slide is in Spanish. So I will talk about it in English because it's already in Spanish for everyone, okay? So the first thing we're gonna do for our guidelines for Shark's Den is that we will have the Exeter medical students present their business case. We'll do it about 5 minutes. So the slides will either be in English or Spanish, or we will do live interpretation to help and support. Second, we will have a period of questions and comments from all of us here, all the students. And so another about 5 minutes. I want to make sure everyone understands that the questions and the comments can be delivered in English or Spanish. We would ask that when you're going to ask a question or a comment that you put your camera on. You can raise your hand. We have the chat boxes as well, and we'll work on monitoring those. And third, but not least, we're going to vote. So we will have a poll. And when we vote, we're going to vote to say, will we support this? Will we support it 100%? Will we support it 50%? Will we support it? And on the side, you can see the options that will be presented for when we have the polls. Jesse, if you can go to the next slide. So as you hear about the case, as we discuss and address questions, make comments, then we will all make a decision and we'll vote to see whether we move it forward, agreeing to fund it at 100%, agreeing to fund it at half, or saying, maybe this doesn't need or address deserve funding at this time right now. Okay, so what I want to do now is pass on, if you go on to the next slide, and I'll have Professor Saulsbury talk a little bit about, if you go, about why business cases.
Okay, so for our students, we have this special, what we call a special study unit, and it's called Improving Healthcare. And as well as for them learning about different health systems and different ways of providing healthcare, they need to come up with where they think there's a need and have a healthcare intervention, and they have to put it in the form of a business case. So, and they'll give a rationale about why they've chosen this particular area. They have to have a breakdown of the cost, some evidence around it, look at the potential barriers, and also how to make it sustainable as well. So, and when we're looking at costs, they are ballpark figures. They're not actually down itemized, by each penny, but it's really to look at, it's preparing them for practice when we all have to put business cases together when we want to introduce something new, something different. And it's all about improving healthcare of either a particular group of patients or a particular population, or maybe even at a national level. So that's where it comes from. So they do a business case and then they do a presentation later on in the year. So they're due to do their business case. And this is to help them focus. Is that okay? You're on mute. Okay. Is that being translated? So some of the titles of the students' projects are here. I didn't get all of them, but there are some more titles as well that will be coming.
So I can do a quick translation. So, bueno, estas presentaciones son presentaciones que los alumnos de la Facultad de Medicina de Exeter han puesto juntos. Entonces la idea es que tienen que presentar un caso, y aquí ven los casos, son 8 casos. Pero lo tienen que presentar de manera como de negocio porque quieren buscar financiación para estos proyectos, lo cual va a ser un caso de financiación, digamos, general, o sea que no nos vamos a concentrar en los detalles ni en los puntos más finos de un caso de presentación de negocios, pero sino para que vayan entendiendo un poco el tema en general de lo que conlleva hacer un tipo de presentación, porque es importante, sobre todo cuando están buscando financiación.
Your feedback and questions will be really, really helpful for the students, as well as saying, would you give them that money? Would you invest in this project? Questions and feedback really helpful because it may also help them to change and think about doing it slightly differently as well. So please do give some feedback or ask questions.
Bueno, y la parte importante también es que nos den comentarios, y como dijo la doctora Hernández, cuando hagan comentarios, por favor, enciendan las cámaras. Entonces, denos comentarios y al final vamos a tomar sus preguntas. Vamos a preguntarles, ¿ustedes financiarían estos proyectos al 100%, al 50% o cero de financiación? Entonces, hagan preguntas, hagan comentarios a los alumnos para que puedan destacar un poco más las ideas del proyecto.
But if you think, no, not good enough, don't want to give them any money, do it.
Pero si piensan que al final que ustedes no financiarían este proyecto, pueden decir que no.
So, are we happy for having some of to start, or do we need to do the information about the poll?
So the information on the poll, it's going to be on poll. So everyone's going to see the website that will be on there. And so what's going to happen is you will have the opportunity to log into a website on your phone or on your computer, and you'll be able to submit your vote that way, and we'll be able to see it live. So I think that'll be interesting. Entonces todos van a poder, cuando empecemos, van a poder ver en una de las diapositivas una página web en la que pueden introducir su nombre a través de vuestro móvil o ordenador, computadora, para que puedan decir si van a dar financiación o no. Doctora Roxana has a question.
Gracias, Jessy. Buenos días y buenas tardes a todos, profesores y estudiantes. Solamente quería agregar que es válido para que los estudiantes participen tanto hablar en inglés como en español. Esto para motivarlos a que hagan las preguntas que indicaba la profesora Nicki frente a la dinámica que vamos a desarrollar. Entonces, vamos a contar con las diapositivas en español, en los dos idiomas, en español y en inglés. Vamos a estar haciendo también apoyo vía chat de los idiomas, por lo cual solicitaría que se habilite el chat para todos y estar atentos para que puedan participar activamente. Solamente quería agregar eso. Muchas gracias.
So Dr. Roxana is mentioning that the presentations are going to be in English and Spanish, and it's important for each student to really make an effort in both languages as much as possible. We are on standby in chat if you have any questions or comments or need translation of any material, but it is important to make forth the effort for this, as it is part of the project itself. You're not going to always be pitching an idea to someone that speaks your native tongue. So it's important to at least make an effort for this. So Dr. Hernandez?
Yes. Well, thank you. Gracias a todos. I think we are ready to start. And we do have some of the titles in an order. So as the titles come up, if the Exeter, I think the first one is the increasing HPV vaccination, el aumento de la vacunación contra el VIH es la primera presentación.
So whoever has this presentation, go ahead and start sharing your screen. El que tenga esta presentación va a empezar a presentar.
Hi everyone, that's me doing the presentation. I'll just continue sharing my screen. I'll start sharing my screen.
Yes, go ahead, and it'll bump mine off. Don't worry about it.
Okay. Brilliant. Is everyone able to see that?
Yes.
Yes.
Okay, great. Well, yeah, welcome everybody. So I'm Thomas Lambert. I'm one of the third year medical students from the University of Exeter. And it's everyone's lucky day because I've got $1 million idea that I'm able to give away for only £55,000. So my idea is an HPV education and vaccination clinic. And I'd like to run a pilot study in El Carmen de Bolívar in Colombia to demonstrate its effects. But before I go any further, I just want to talk you through the story of the HPV vaccine and cervical cancer in Colombia. So the story of the HPV vaccine in Colombia. So cervical cancer is one of the leading causes, it's the leading cause of cancer mortality in Colombia, and it's the second most prevalent cancer behind only breast cancer. So there's been various studies that have shown that with current screening programs and the success of the HPV vaccine rollout so far, the cases of cervical cancer may double in the next 15 years. So in 2012, the HPV vaccine was rolled out and it was introduced to 9 and 13-year-old schoolgirls. In 2013, it was all going pretty well, actually. And Colombia had one of the highest coverages in all of the Americas of 88%. But in 2014, something terrible happened and 500 girls reported adverse symptoms to the HPV vaccine. This then disseminated through national and social media, and distressing videos were seen by many, many people. And then it was then found out that there was actually no association between the vaccine and these adverse effects. And then by 2016, it was effectively too late. And the first and second vaccine coverage hit 14% and 5% respectively. It's thought that in these birth cohorts, there will now be an additional 1,800 preventable deaths each year. So this graph demonstrates what I've been saying. So we've got the years down at the bottom, and then the HPV vaccine coverage on the side axis. And it demonstrates the success of the initial program with high percentages of uptake of close to 90%. And then in 2014, the vaccine crisis episode happened. And then from then on, the confidence in the vaccine has fallen, and the uptake has therefore dropped to low figures of 14% for first dose uptake and 5% for second dose uptake. So now time for my solution. So I mentioned it earlier, the HPV education and vaccination clinic that I'd like to offer nationwide. So there's a three-prong approach to this. So we'll provide educational talks in schools, of which will be provided to the target population, the 9 to 14-year-old school children. And then also their parents and family members are welcome to come along and join. They'll also be provided with an evidence-based leaflet outlining cervical cancer, the HPV vaccine, and it's not designed as a persuasive resource. It's designed as a neutral resource to educate using evidence-based research. And then later on in that same week at these schools, we'll then offer an optional vaccination clinic, of which any of these 9 to 14-year-old children can choose if they want to sign up and have a vaccine for HPV. So I'm hoping by doing this, we'll enhance the education, we'll enhance this target population with educated decision-making on this topic. We'll be able to tackle the misinformation, and we'll be able to increase the HPV vaccine uptake. So obviously I can't start this nationwide immediately. So I want to start with a pilot study. And the area that I want to focus on, as demonstrated with this on the right-hand image with the green small area, the El Carmen de Bolivar municipality. So this was where the outbreak of the misinformation occurred, and the 500 cases of adverse symptoms that were wrongly associated with the vaccine. So my study duration would go on for 9 months. And so there's one hospital in this town, as shown with this map image in the center of the town, which will act as a base. So the vaccines will be stored there, and then we will then take the vaccines to the school. So the target population, there's approximately 7,000. So there's approximately 7,000 children aged 9 to 14 years old, spread over 17 schools as shown on the image. The current first dose uptake is 33%, and the current second dose uptake is 11%. So my study, the outcome measures would be to increase this first and second dose uptake and hopefully increase the complete vaccine cover for HPV. So as far as approximating the costs, it should cost around £55,000 of which the vaccinations should be government provided and therefore free or heavily subsidized. I've estimated that it would require 2 employees to carry out this process, of which 9 months of salary for both of them, around £42,000. The vehicle and transport costs for insurance, petrol, and a GPS system, 11,500. And then for the leaflets, design and printing, 7,000 copies for the target population would be just over £1,000. Data recording would be conducted on a tablet, of which would require 2 for each of the employees, so £400. And then security would be a further £800. And here are some references that I've used throughout. And yeah, so thank you very much for listening. I just want to leave you with one final remark, which is for £55,000, we'll be able to better look after our future population against this horrible cancer. Are you with me? I welcome any questions.
We have a hand up.
Oh, I can't see any hands up, so feel free to ask your question.
I have a question. Will you have any trouble getting into the schools, or how are you planning on being able to work with the schools to make sure that you have ample time to educate and then go back and do your clinic?
Yeah, so great question. So there's 17 schools in this town, and the hope would be to communicate with them in advance. So arrange a time when we'll be able to come in. So we'll probably target 1 school per week, is what I was aiming to do. So we'd perhaps see them on the Monday of the week or towards the start of the week to provide the educational talk. We'll then at that time provide them with the educational leaflet. So then they can take it home, discuss it with their families, hopefully spread some useful information about the vaccine. And then towards the end of the week, so perhaps the Wednesday, Thursday, Friday, we'll run the vaccination clinic. So the target population will be able to book onto the clinic, and then we'll be able to then bring the correct amount of vaccines accordingly.
Great, thank you. Nice presentation.
I think Joel has his hand up.
Yeah. Thank you, Tom. My question is that how do you want to ensure the potency of the vaccines that will be used? What information do you have about the logistics and the vaccine storage in the country?
Okay, so the vaccines would be stored in the hospital, which was in the center of the village. So it'd be stored there. And then according to how many of the target population have signed up for the vaccine clinic at the school, we'll then take the vaccines, we'll transport them from the hospital on the day to the vaccine clinic at the school to then conduct the vaccine program. Does that answer your question, sorry?
Oh, well, theoretically it answers it, but practically, I don't know whether you are familiar with the terrain of the environment. What is going to cause? What is going to take you to move from one location to another? From the storage, the storage location to where you are going to utilize the vaccine. Also, the storage process itself. What temperature do you need to maintain? What are the backup that you need in situations where electricity may fail? Are there any other thing that you need to put in place? These are some of the things that I was expecting that you need to provide information so that you will not get stuck along the way. Yeah, sure.
So unfortunately, regarding some of that information, I'm not 100% sure about, but the hospital should provide an environment that would be suitable to hold the vaccines. Were there any further questions?
Yes, I think Roxana's.
Gracias, sí. Voy a hacer la pregunta en español para motivar a mis estudiantes. que sé que están por allí. Mi pregunta, bueno, primero agradecer a Tom por esta presentación frente a este problema que tenemos en el Carmen de Bolívar como un referente. Diría yo que es más en un contexto nacional, pero Carmen de Bolívar ha sido una población en donde surge esta problemática que él comentaba de los casos, y eso tuvo un impacto negativo en la vacunación. Entonces, mi pregunta es, frente a justamente la situación que se presentó, ¿cómo garantizaría esta propuesta la sostenibilidad del programa de vacunación si lo que nosotros vemos es más un rechazo a la vacuna? Es decir, de hecho, para el esquema de vacunación en Colombia, el BPH está incluido hasta jóvenes, si no estoy mal, hasta los 16 años como política, pero las jóvenes no se vacunan porque hay un tema frente al temor, frente a los efectos que se evidenciaron en algún momento de la vacunación. Entonces, esa es mi pregunta. Voy a hacerla ahora en inglés, de todas formas, para que Tom tenga como la orientación. Aquí la está colocando Ivonne. La voy a leer para más precisión. How would you guarantee the vaccination program if mostly the lack of the vaccination is related with the refusal of the vaccine? How would the program guarantee that the young people access to the vaccine?
So it's not so with the vaccine program, the whole point of the whole process is to educate around the HPV vaccine. So we're educating the target population. We're providing these neutral educational resources which allow them to then make an informed decision on whether they want the vaccine. It's not designed to persuade and like influence their decision. It's designed to apply, like give them the resources to be able to make an informed choice of whether they then want to refuse or whether they want to take the vaccine.
Sí, tal vez me atrevería yo a agregar como recomendación tener en cuenta que también hay un tema, un movimiento, podríamos decir, que hay ciertos movimientos que refuerzan el rechazo a la vacuna y no solamente al VPH, a otras vacunas. Entonces sería bueno que, como ustedes lo plantean, esta línea del programa, del proyecto, sea una de las más fuertes, de tal manera que se rompa con esas creencias que tienen las personas en torno a la seguridad de la vacuna. Entonces, ese creo que es un aspecto importante. I just was remarking about the importance that have this point in the program that you are proposing, because not only for HPV vaccination, for all the vaccine programs, especially because we see that globally there are some anti-vaccine movements that are working a lot in this area. So I think that this is one of the most important things that the program needs to reinforce, like our recommendation for the program. Thank you, Tom.
Thank you. Are there any further questions?
All right, so I wanted to add something. Can you go to your first slide?
Yeah.
So a lot of my recommendations So I'm going to approach this from a non-clinical perspective and just give you my initial thoughts, if you will.
Okay.
So the name of the city is El Carmen de Bolivar, correct?
Okay. Yeah.
So try to keep the name on the same line because it's the entity, it's the name of the town. And so I know it sounds like a really small detail, but getting the name and the spelling and keeping everything in line is going to be a point of respect to the individuals in that town. And then my other comment would be, you are presenting this to Colombians and there is not one Spanish word on here, not even a thank you in Spanish.
Okay. Yeah. No, that's something that I definitely like could work on and improve on for next time I have an opportunity like this.
Yes.
But yeah.
Well, it's just a matter of kind of understanding and knowing your audience.
Yeah.
And so overall, good presentation though.
Thank you.
Yeah, I agree. I think good job in presenting this, good discussion and questions, and really, leading to that the issue. I think the larger issue is the vaccine hesitancy and the impact that has globally. So great job. And then I think if we are okay, Professor Saulsbury, we can move to our first poll.
Let me share that screen. Give me 1 second. I apologize. Okay. And then I will clear the responses. So if everyone can go to the website on the screen, pollev.com /Jesse Casanova 654. Si todos pueden llegar a la página web que ven en la pantalla. Y quédense también ahí en la página porque después vamos a preguntar más preguntas y así no tienen que introducir la información más de una vez. And once you've entered your name, just go ahead and stay on the website because we're going to ask this after every presentation. So you don't have to re-enter the information every time.
Jessy, ¿podemos tener el link en el chat también? Exacto, gracias.
Sí, déjalo busco aquí. Dr. Hernandez, would you mind putting the link? I can't access the chat since I'm presenting.
Perfect. Thank you, Isabella. So the link is in the chat.
Yes, we have 17 responses so far.
Clarify something. Overall, for all of the presentations, do we have a limited pot of money or do we treat every presentation separately?
It's an unlimited pot of money in this fantastic world that we've invented.
Toda plata es posible, no es un programa contra el otro, cada programa es individual haciendo esta respuesta.
Okay, so we have 24 responses so far, and 58% have stated they would fund at 50%. Okay.
Perfect. Gracias. We will move on to our next business case. Breast self-examination, el autoexamen mamario. And we will have a student from Exeter sharing their information about their business kit.
So who's got this presentation?
Hi, it's me. I'm just trying to figure out how I'm doing this. So I just share my screen.
Yes, go ahead and just share.
Sorry, I think this has become confusing. Is that showing everything? Okay.
Yes.
Oh. Right. Can you see presenter view or can you see normal?
We can see your presenter view.
Oh, damn. Okay. I'm doing this wrong.
If you just switch it back, we could see it before.
Perfect.
Sorry, one sec. I'm having a problem. I've confused myself. One moment. Can you still see presenter view?
No,
No.
we just see the screen.
Okay, there we go. Sorry, I figured it out. So, hello everyone. Today I'm presenting a proposal for a breast self-examination campaign. And I'm going to explain why this is a very low-cost idea that can have a huge effect and hopefully bring about some really good changes. Okay, so starting with the problem. So apologies, this is an old figure. It's slightly outdated. It's from 2018. But as you can see, breast cancer is still the second most prevalent cancer in Colombia, with an estimated age standardized incidence rate of 48.3 now. And despite there being like lots of significant improvements in 5-year survival in Colombia since 1995, it's gone up from 65.7% to 72%. It's still, breast cancer mortality is still on the rise, and around a third of breast cancer diagnoses are still made in the advanced stages, so stage 3 or higher. In the UK, for comparison, this is around about 13% at the minute. And there is a national screening program of mammography where women between 50, from the age of 50 are invited and encouraged to get mammograms at least every 2 years, and also to have regular clinical breast exams. But there is poor uptake with this program, and participation remains sort of quite low overall. And there are also some clear disparities according to a woman's socioeconomic status. So the coverage in women with subsidized health insurance is about half of that of women with the with private health insurance. And those issues are quite surrounding this inequity are quite complex, and at their crux, they sort of involve significant differences in access and the quality of health services available, and then also the opportunity of the women. But a survey did find that about 23% of Colombian departments lacked mammography service facilities. And so a large proportion of women are having to travel to other departments to access these services. So what I'm trying to say is that larger investments in the infrastructure are definitely needed in order to address these sort of larger inequalities and enact real long-term change. However, I did, through some research, I found that a Colombian study that saw that breast examination educational interventions have significantly improved women's ability to perform a breast self-exam. And while a breast self-exam cannot replace mammography as the screening method, it does help to encourage women to check themselves regularly, and it can help bridge the gaps that are seen in access that currently affect women who live in areas without these mammography services. So that brings me on to my solution. So I'm proposing a breast self-examination and sort of breast cancer awareness campaign that's quite similar to something we have in the UK called Copperfield, which is a charity that was set up by a woman here who got breast cancer quite young, and she was dismissed for a while, and it wasn't until she really pressed for it that she was diagnosed. And she felt that if she had been empowered to check herself regularly and to trust what she was, and she had more knowledge about what she was feeling and noticing, she could have got herself checked out sooner and started this process sooner. And so there's a huge campaign here with I know at the university I've seen Copperfield, people representing Copperfield around at our university, and it's been quite successful. So I wanted to do something quite similar to that, but in Colombia, focusing really on encouraging women to check themselves and to seek help if they're worried. So my proposal, there are 3 prongs to this campaign. I'd like to produce informative posters that explain how exactly you're meant to do a breast self-exam and what signs and symptoms you should watch out for. And then also to run adverts of the similar sort of posters on buses and also on Facebook. And then also to have regular radio adverts to encourage breast self-exam and to get women to encourage them to check themselves out and to raise awareness of sort of red flag symptoms as we know them. So that was my idea. And if we go on to the costs, so this is quite a cheap campaign. I'm hoping to only run it in Barranquilla at first, as we're working with the university now, and I sort of felt that there was I know people there, so hypothetically I would be able to have contacts there, and if I were running this program, that would be how I would help make sure that it's managed, is hopefully through contacts within the university there. But £5,100 is quite a small price to pay for potentially reaching thousands of women and encouraging them to get checked and saving lives if they get checked and it gets caught early. So the costs would be split for a graphic designer input to make sure that the posters are really eye-catching and that they provide the information that is necessary. And then printing of some posters to display at health centres and schools and places where younger women especially, but also all women will see them. And then I was thinking that through contacts within the university in Barranquilla, we could get the posters put up for free with the kindness of those people. But then the majority of the money would be spent on bus adverts. So to get about 10 bus ads for 6 months, it'd be about £2,000. Sorry, that should say for my Facebook adverts, they'd be for 10 months, 6 months, sorry. And for radio adverts, a 30-second advert is about, for 10 times a day for 6 months, is about £2,200. So I think according to recent estimates, that is around 25.3 million Colombian pesos. I think that's a rough estimate, I'm not sure. But yeah, as I said, this is a very low cost campaign with potentially huge effects. And if it's effective in Barranquilla and there is an increased uptake in women going to be seen by their doctors for breast queries, then it could potentially be spread out throughout the country. But yes, thank you very much for listening. These are my references. Do you have any questions?
Thank you. Thank you, Hannah. So let's see, let's open up for any questions or comments on this breast self-exam campaign for Barranquilla, Colombia. ¿Alguna pregunta o comentario para el programa de autoexamen mamario que presentó la estudiante?
A ver, los estudiantes de Colombia, Uninorte, tomen la palabra. Ninguno.
All right, I have a question.
Mm-hmm.
Let me. So I actually had a few questions. So the prices that you mentioned for your radio ad, how did you arrive to that number? La pregunta es, ¿tienen los precios para poder dar propaganda sobre la radio, pero cómo consigue los precios?
So I initially quite struggled to find estimates for within Colombia. So I had to start like researching how to say it in Spanish to search it. And I found a website that broke down average costs within Colombia. I don't know if it's accurate or not. I can't speak to that, I'm afraid, but I found a website that broke down radio advert costs in Spanish in Colombia.
Okay. And then why radio?
So I think one of the things I wanted to focus on was reaching women who maybe can't be reached outside of that, who have fallen through the gaps. And I thought radio was a good way to reach a wider audience. Also maybe people who aren't drawn to reading posters that sort of look quite busy or informative. I just thought it would broaden. If we gave a wide scope of different ways to reach women, it would be better.
Okay, thank you.
Sí, me surge, tomo la palabra, más como sugerencia para la campaña, que por supuesto es un tema muy importante frente al problema planteado, pero diría yo que se debería reforzar más en el tema de quizás redes sociales, en el sentido de la misma pregunta que hacía Jessie. Redes sociales, no sé, que le puede llegar más a las personas, porque me ubico en el contexto de Barranquilla y bueno, tenemos rutas de buses que usan radio, estación de radio, le va a llegar a un número de mujeres, pero es como solamente un grupo, digamos. Entonces, sería esa parte. I was telling more about a recommendation for the campaign. It would be better if you consider to reinforce more the campaign in social media, because the radio station is more for a small group of women that use public transportation. So focus more the campaign in that area would be better. Thank you, Hannah. Excellent.
Okay. And Turi, Loris, Muñoz, ¿tienen comentario?
Turi, adelante. Parece que no. Ah, Stephanie, adelante, Stephanie.
Hola, profe. Un comentario.
El micrófono, vimos.
Listo, ahora sí se escucha.
Mejor.
Ok. Lo que voy a hacer más que todo es un comentario en una pregunta. Excelente presentación, la de Hannah, y pienso que es muy útil y necesaria, sobre todo en Barranquilla, que a las personas en general sabemos que el cáncer de mama no solamente está afectando a las mujeres, sino a los hombres también. Y en Barranquilla aún existen muchos tabús sobre esto, sobre realizarse un autoexamen. La gente aquí toma pocas acciones a pro de su bienestar, o toma pocas acciones de autocuidado, y es lo que hace que haya más incidencias de casos de cáncer de mama en Barranquilla. Entonces la gente, esto también no eliminar, sino que disminuir o cambiar la percepción que tienen las personas sobre el autoexamen. Lo ven como un acto muy vergonzoso, les da pena, entonces no permiten que la enfermera lo realice, y ellos tampoco se lo realizan ellos mismos. Y también la gente asiste muy poco a sus controles médicos aquí en Barranquilla. Son muy pocos los casos de personas que van al médico simplemente por control o por chequearse. Entonces es muy, muy útil, muy buena la presentación de Hannah.
Ashley, if you want to share your comment, I agree.
Yeah, I just put in the comments that I think it would be important to have a consultant that lives in the country, just to sharpen the approach of the campaign. Because like personally, I'm from Honduras and things are so different in Honduras too, that like, I think sometimes we don't realize how or what really goes on in the country. But yeah, overall it's very well done. And I know it is difficult sometimes to find resources or information from a different country as well, but great job.
Thank you, Ashley.
That's a good idea about having a sort of almost like a Colombian campaign manager to make sure that things are reaching people who they need to reach.
Exactly.
That's definitely something to add in. Thank you.
No problem. Thank you.
Yeah, and then I'll just add that in addition to that, the comment the Uninorte student just made about the self-breast exam, embarrassment, not comfortable touching their bodies. So this is all insight that in addition to having consultant or maybe doing some focus groups, regardless of what the topic is, would help you to learn a little bit more about the population. And I think that whether, you know, we're in the UK trying to do something in Colombia or here in the US trying to do something in Tampa, Florida, learning and being able to understand the population and get that information is so important for us.
Okay, shall we move to the poll?
I think so. Good job, everyone.
I feel like there needs to be background music happening here.
Yes.
Okay, we've got 22 responses. 48% would fund at 100%, 43% at 50%, and 9% would not fund the program. We got some very dedicated sharks here.
Yes, yes, Professor Saulsbury. And in regards to cultural competence, I think that is a huge term, and I think we all strive to reach that. I also want to remind everyone of another term. It's called cultural humility, and it's part of that process. And that term, cultural humility, really makes us start to look not only at ourselves, understand ourselves, but be open to others. La profesora Saulsbury compartió el término de competencia cultural. Y eso es un término muy grande, algo que todos trabajamos a llegar. Y quiero yo presentar otro tema, se llama how do I say cultural humility? Humildad cultural.
Humildad.
Humildad cultural, en cual empiezo cada uno, yo misma empiezo a aprender, a saber, aprender quién soy yo, de dónde vengo, cuáles son mis valores, o sea, mis experiencias. Estoy bien enfocada en quién soy para también estar abierta a otros que conozco y tener esa mentalidad siempre de estar abierta porque es constantemente. Thank you, Professor Nicki. The next proposal up is cataract screening, detección de catarata. El próximo. Is it Lily?
Yeah, hello, that's me. I'm just going to try and share my screen. Sorry, might just take a minute.
You're good.
Can I just say that we've got as I put in the chat, there are a couple of our students who weren't able to get their titles in time. So we've got a couple more who we don't have on the list. That's okay.
Okay, so hopefully can everyone see that? Okay, so my project is about cataract screening and education in Colombia. So hopefully my project will offer screening and education for cataracts, to one rural region of Colombia. I haven't decided what rural region this will be yet, but I think I quite like to carry out some extra information gathering from people to decide where this screening program would be most useful. But from data nationwide, I think this program could be really useful. So what I'm hoping to do with the screening is test for visual acuity. So using a Snellen chart, like you can see on the slide there, to kind of make sure it's inclusive to everyone, and language isn't a barrier to screening, because you don't need to necessarily say the letters on the chart to understand what visual acuity someone has. Also carry out an eye examination to kind of view a pacified lens. So in cataracts, what usually happens is your lens starts going a bit cloudy. So as you can see in the top image, it will be kind of noticeable if someone's developed it. Also do ophthalmoscopy to detect the red reflex. So that's kind of using one of those like eye tools that then you can see in the bottom slide. If someone's got cataracts, you won't be able to see that redness in their eye. Also then use a refractive lens to see if myopia can be corrected. So if someone's got cataracts, their short-sightedness won't be corrected using a lens. So therefore it is true cataracts. So then during the screening process, patients can also be educated on the signs of cataracts. So hopefully then kind of knowledge of cataracts can spread in the local population. And the treatment of cataracts can be explained in a bit more detail. So if a patient does have it, they're a bit more knowledgeable about what their next steps will be and their treatment options. So that could be surgery, or it could be kind of more conservative, so trying to use lens to correct their vision. Okay, so then why is this kind of screening needed? So at the minute, the latest data I could find suggested that as much as 68% of blindness in Colombia is said to result from cataracts. And there isn't, I couldn't find a kind of reliable system so far taking place that's picking up cases before visual acuity keeps declining and the cataracts progresses to a point of blindness. And although this project is limited to the cost of cataract surgery, which could be a limitation to someone getting treatment for it, two other important barriers to surgery that have been identified are the lack of awareness of the benefits that surgery could give someone, and also the lack of resources to finding cases. So not enough people are realizing they're having cataracts, so actually there's not enough surgeries happening that should be. So hopefully this project will help address both of those barriers. Also implementing a permanent service in an area. I want to go for a bit of a more rural area, as I think those are people with less access to kind of screening currently, or ophthalmology services. And also hopefully it will allow culture for assessing screening to develop. So if someone notices those signs in a relative or a friend, they can go and tell them about the screening service, and then they can access it a bit easier. And also local knowledge of kind of the treatments that are available and what kind of the outcome is can develop a bit more. So how I'll be able to tell if this kind of screening program works is cataract blindness data can be collected in the kind of the year that before the screening program is implemented, and then the year after, to see if that decreases and see if people actually are taking up treatment after they've accessed the screening and the education program. Also cataract surgery rate can be obtained before the program to see if actually these barriers of kind of education about the knowledge of cataract treatment and noticing it in the first place is making a difference to how many people are opting for surgery. And it's not all related to the cost, which is why there's so much prevalence of blindness. So the funding required, I put some equipment for cataracts diagnosis will be needed, which is quite relatively inexpensive and multi-use. So the main cost of the program would kind of be incurred at creation, and then it can be carried forward for years if it works. So cost to carry out for in one region for the year, I thought ophthalmologists can train peer assessors, so people from that local kind of village or town, so people that the patients or people accessing the screening are going to trust and kind of know how to communicate it in a way that can come across how people will most likely view it in a positive way, so they can kind of just say it how they think people will access it the best, really. And then they can educate that local population afterwards from those peer assessors. So I put maybe they'll need about 10 hours of training needed to kind of perform that screening and to educate people on all the kind of facts and figures. So I put that at around £200 if you're paying an ophthalmologist £20 an hour to do that. Then equipment costs, so like the Snellen chart, so the one I had on the previous screen, an ophthalmoscope and a refractive lens. Also then equipment maintenance, treatments, and also some information leaflets explaining treatments. So if people want to take them away to have a think about it, they can. And then I also put the screening can be carried out in public places, such as kind of a centre or somewhere, kind of a public place, so it wouldn't occur too much cost. So I got a rough kind of figure is 870 to kind of £900, because I know that's quite exact. So yeah, kind of a relatively inexpensive screening program, but hopefully one that will make a massive difference to people's lives. As I talk about it more, like our extended business proposal, but blindness is something that can really impact someone's quality of life, and something that if it can be avoided, like in this situation, potentially might be really beneficial. So thank you very much for listening. If anyone's got any questions, please feel free to ask.
Okay, so we are open now for questions or comments about the cataracts prevention, cataract screening program provided by Lily. ¿Alguna pregunta o comentario para el programa de prevención de detectar cataratas? Let's see. Any questions or comments?
There are a couple of hands up.
Okay, we have
Hillary, you go first.
Hillary, adelante.
Hola, ¿me escuchan?
Sí.
Bueno, yo creo que es un proyecto, digamos que muy viable aquí en la costa, en Barranquilla, en la parte de, digamos, donde el nivel de salud es muy precario por los recursos, los pocos recursos que se tienen. Por ejemplo, aquí en Barranquilla está la Clínica Oftalmológica del Caribe, que esta recibe a muchas personas que no son de aquí de Barranquilla, sino de regiones, digamos que aledañas a Barranquilla, porque en esas zonas no están los recursos que ellos, digamos, necesitan para tratar esos problemas a nivel oftalmológico que tienen. Entonces, yo digo que es un programa muy viable, porque así se detectarían a tiempo y podrían, digamos, enviarse a las zonas donde sí hay los recursos para tratarlos. Porque quizás cuando ya llegan aquí a la clínica ya están muy avanzadas las enfermedades que presentan.
Thank you very much, Hillary. If someone would be able to translate that, please.
Sure. The student from Uninorte suggested that this would be a very viable program. The current health prevention is low in the area. They receive many community members who also may not necessarily be from Barranquilla. So having this program to screen the student feels would be great, as long as we have the resources to treat as well.
Yeah, no, thank you very much for that. Yeah, no, that is something I struggled when I was researching this topic, because there's a lot kind of that I thought would be a good point to intervene at, but I thought maybe a screening program and education first. You can see, I think even if it turns out that there's a lot of cataracts that's still going untreated, then at least it points kind of intervention further in the direction of making cataract services and surgery a bit more accessible. But my thoughts are, from the research, a lot of it happened to kind of focus on the barriers at the minute, could also be education. So I thought maybe that's where I'd start.
La estudiante Lily comparte que ella quería enfocar primero en identificar y dar educación, porque en esa manera va a poder aprender, saber con qué frecuencia está ocurriendo. Entonces la segunda parte sería si la necesidad identificada, hay servicio Entonces, si no hay suficientes servicios, entonces sería una segunda parte que se puede trabajar. Pero por eso quiso empezar con esta primera. I just translated what you said. Any other questions or comments? See, Eric, Sue, Amanda, see.
I've got a comment. So not to become the meme guy of these shows, but again, I'm looking at it from a non-clinical perspective. So your slides have a lot of great information, but they're very busy. And if I had cataracts, I couldn't read the second slide because the print was so small. I suspect that what probably happened is after my first comment, everyone went in and quickly did some translation and they're adding it to their slides, which is great. I'm happy that you guys are doing that. Just make sure that when you're presenting that, you know, PowerPoint slides are meant to be visuals. So try not to add too much information in one slide to keep people from, you know, losing focus of listening to you present.
Yeah, that makes sense. Thank you.
Está Janine, otra estudiante que tiene, aprovechar que están alzando la mano. Janine, adelante.
Okay, first of all, I'd like to say congratulations to the student who presents this.
No te escuchamos bien. Cerraste el micrófono.
No, you can hear me. Can you hear me?
Ahora sí.
Okay. I'd like to add a comment because last semester I had this patient who had this cataracts, and when I was talking with him in his room, he told me that he had this disease about 10 years or 20 years, and he couldn't go to the doctor because he didn't know that this disease have a surgery. No. So it's very important because she told something about go to the doctor and have these persons who have educations for educate other people. That's it.
Quería asegurarme que entendí bien. El paciente te dijo que sabía que tenía este problema hace 10 años.
Tenía cataratas hace como 10 años, pero él no sabía de que existía cirugía para ese problema. Entonces creo que ella decía algo acerca de que educar a educadores para que puedan educar a las otras personas, hacerles los exámenes y que puedan decirles o darles información acerca de las cataratas y que puede ser prevenible, que puede ser tratado.
Perfecto, gracias. So the patient had this for 10 years, not aware of surgery, of options, and really was not seeking that. So by the time they saw the patient, it was very advanced.
Yeah, thank you very much for that. It's really interesting to hear a story of where this could have actually benefited someone. So thank you.
I have also a recommendation for Lily. Lily, it would be better if in your program you add more information about the cost, because we don't know how much it will cost. But I want to highlight the importance that have the idea to educate other healthcare professionals by ophthalmologists, because I think this is like the heart of this project, according to, and all the things that my students say, I totally agree with this. And I think this is a very good opportunity to reinforce in especially rural areas this type of care. Thank you, Lily.
Yeah, thank you very much.
Okay, I think we are ready for our next poll. And
Okay.
I found that we have reactions here, so we can clap. Can you see me clapping?
Oh, yeah.
Okay, good. So we have emojis here. Yes, we do. I just found them.
All
Okay,
right, we're getting responses.
here we go.
It's looking good for Lily. It's looking good for Lily. All right, we've got 20 responses so far. We'll give it another 5 seconds. All right, so Lily, 60% would fund it at 100%, 27% at 50, and a negligible amount without financing, so 0%. Good job.
Thank you.
Okay, so now we're on to our next business class, business case, traffic pollution, contaminación del tráfico. So let's learn more about what we can do about traffic pollution. ¿Qué podemos hacer contra la contaminación del tráfico?
Can you see my slides?
I can see your slides.
Okay, great, thank you. So I'm Catherine, I'm also a third year medical student at Exeter, and I'm going to be talking today about traffic pollution and the way we can reduce air pollution because of traffic. And so I'd like to propose congestion charge that I'll talk about a bit later. So congestion charge is
I'm sorry, pardon my interruption. I'm sorry. Can you turn your camera on?
It is on, or at least it should be on. Can you not see me?
Yeah, I can see you.
Okay.
I can see you.
I see you now.
I
Okay,
see
it was
you.
off for a second. Sorry about that. I'm
Okay.
sorry.
Sorry about that. My internet is not amazing. Yes, sorry. So congestion charge is essentially a scheme in which when you enter a certain area, you get applied a cost for driving in that area. And its point is to try and dissuade people from driving in central areas. So air pollution is a massive problem and has big effects on people's health. So PM is particulate matter. So it's little bits of like solids, like dust and soots and stuff. And 2.5 basically refers to its size. So anything over 2.5. So in Medellin, it's said to have 160 micrograms per meter cubed, and basically the recommended max for a healthy place is 10 micrograms as set by the WHO. Even in places where congestion charge has been put in place, it's still not perfect to that recommendation. So it's about 33 in London, even though we have congestion charge, but it has been massively reduced since. And it can contribute to up to 3,000 deaths per year. So a reduction in 1 microgram could prevent just over 50,000 cases of cardiovascular disease, around 1,700 strokes, around 10,000 cases of asthma, and also prevent around 4,000 cases of lung cancer. But it does have other benefits of reducing air, other than reducing air pollution. So originally there was a scheme called Pico y Placa that was also placed in Medellin. However, it's not really working, as essentially what the scheme was it limited when you could come into the city with your car, depending on the last digit of your number plate. But a lot of people have either bought second cars to bypass those regulations. So the congestion has returned, and lots of air pollution is still around, and it's returned to similar figures as what it was before. And this scheme is also could potentially make money, and that money could be used to improve public transport, so people might be more likely to take it, and also be used in other environmentally friendly things like restoring natural habitats and other things. And of course, as it says, you could have a reduction in the amount of cars in a place, and that might lead to less road traffic accidents. So with air pollution and reducing that and congestion, it would have a positive impact on the healthcare system, as they'd be under less stress. So what are the potential impacts? So in London, we have congestion charge pretty much throughout the entire working hours and day hours. And currently it's £15, but it did start off as £5. And it's reduced traffic by 27%, which means there's 80,000 fewer cars. And there's also been a great improvement in air quality. So the particulate matter over the size of 10 has reduced by 12 micrograms. So, however, this does have a risk. So unlike the others, my upfront cost for my project is rather large, because this is a large scheme. So I'd like to implement it in a city. And it would also mean, because less cars are being used, you'd get less taxes from fuel prices and parking and VAT payments that public transport is exempt from. And it might cause some overcrowding on public transport as well. So though that income that is generated, I would like to put it into improving public transport to try and diminish that risk. So what will it look like? So I'd like to implement the congestion zone where you enter in the central area of Medellin. And I'd like to have it during peak hours in which people are traveling to and from work or to town. So I put it here as 6:30 to 8:30 and 5 to 7. I'd like to make the charge cost 6,000 pesos, which is about £1.20. And I'd like to monitor its impact by looking at the air quality index. There's already infrastructure and monitoring sites for that in Medellin already. And also look at the number of hospital admissions for complications of cardiovascular disease, so heart attacks and strokes. And I'd also like to look at people who come in with really severe asthma as well. So what are the costs involved? So I don't want to bog us down too much with loads of numbers, as this is quite an expensive scheme. So I'd like to have an initial investment of £20 million, and that goes into repurposing all of the things that were used for Pico Placa. So using those cameras and all the staff and their office space, etc., because I don't think there's really need for two traffic schemes. And this way, you know, people get to keep their jobs, and also it might potentially generate more jobs with retraining people. So I put retraining staff so that they're able to understand and implement congestion charge costs, and also recoding of cameras so that they know what they're picking up when they see cars drive past them. And I'd also like to implement an automated charging system that's similar to what we have in London. So basically, so I could direct debit that you pay, and you essentially every time you enter this area, it gets recorded and written down, and then it just tallies it up and sends you a bill every month that you pay directly from your account. So running costs per year is probably around 11.4 million. So that includes employee salaries and office space and utilities for that office. And also electricity and maintenance for the equipment, which is mainly cameras. So I also calculated in some of the money lost from all those payments I was talking about with fuel and parking fees and stuff. And I estimated that around 10 million. However, congestion charge collected per year should still be higher than both the running cost and the money lost. And ideally, I'd like to have that investment cost originally covered in around 8 years. So what's this all mean? So this initial investment could allow for an income generating scheme, and this could improve everyone's lives with their health because of the improvements of the air quality, and also making the city better by, you know, improving public transport and better roads and cycle lanes, and to keep people healthy. Here's just a list of my references, and thank you very much for listening. Any questions or comments?
Have you seen the question in the chat?
Yes. Yeah, so I do think that's a really interesting question. I do think that there has been a reduction into like air pollution and deaths from things that might have been contributed to pollution. And I actually did read a paper on it that was saying it had decreased because of COVID, because there were less people going around. However, I do think as time occurs and COVID becomes more of a normal thing like the flu, I do think that we'll return to in-person working, as it is. It's really like essential for human connection, and you meet so many people through work, and it's really difficult just working online and speaking to a screen all the time. And of course, there's obviously people who must work in person. So especially like healthcare professionals and other essential jobs who people need to be in person, they will still be using their cars.
Thank you. Yo puse una pregunta en el chat. ¿Cómo cree la estudiante que ha afectado el trabajo virtual, el movimiento virtual con la pandemia de COVID? Y el estudiante dijo que sí ha visto, ha leído que ha bajado los niveles, pero también realiza que como estamos ahora en el programación a volver a la nueva normalidad, porque es crítico tener los encuentros que hemos tenido antes y los diferentes tipos de trabajo, que los niveles van a subir otra vez. Do we have anybody else with a hands up? ¿Alguien más con un comentario o pregunta?
Yes.
Okay, so real quick, I have two questions. So the first is, what would the impact of this be on public transportation in Medellin? And secondly is, have you considered the unintended consequences of creating a black market for license plates that would have them, give them the right to drive on that day?
Sorry, now that you've told me your second question, I've completely forgotten the first one.
No worries.
So if it's okay, do you have a preference to which one I start with? Or?
Nope, go ahead.
Okay, so the scheme in which, depending on what your number plate is, you get in, you're allowed to drive in the city. That is the previous scheme from before, the Pico Placa one. I have no clue whether I'm pronouncing any of these things right, by the way, I'm really sorry. So basically what I'm trying to propose is congestion charge, which covers all cars, not just the ones that are allowed to drive into the city on a certain day. So with my scheme, I'd like to repurpose Pico Placa and just make it universal for all cars. And essentially when you drive past a camera, it records your number plate, which is associated with your address and name. And then you're sent the bill at the end of the month. Sorry, could you repeat your first question if I'd answered your second one?
Sure. What potential impact do you see this having on public transportation?
Oh, great. Okay. So I do agree at the start of this scheme, because we are not essentially making money at the start. I do think that public transport could potentially become somewhere where there's increased crime and there's a lot of overcrowding and it's quite difficult. But I'd like to use the money that you're generating with this scheme to put it into public transport and improve services. So get new buses and make the services more frequent. And I'd also eventually like to make those buses electric if possible, to make them even more environmentally friendly. To cover crime, I'd also like to maybe consider cameras to surveil the area a bit better. And I mean, potentially, if it's really bad, I mean, in large train stations and airports, there's always a bit of police presence. So that may be something I would consider.
Thank you. I think Dr. Roxana has.
Gracias, Jessie. Sí. Muchas gracias, Catherine, por tu presentación. Veo tu propuesta bastante ambiciosa por los valores que nos mostraste, bastante interesantes, ¿verdad? Y el impacto también. Yo tenía más que una pregunta, quizás una recomendación para tener en cuenta, y es el hecho de una de las multas que tienes para el congestion control. Decía como 6.000 pesos colombianos, en la parte donde dice 6.000 pesos colombianos. Entonces no sé si 6.000 pesos pueda ser una suma que verdaderamente, digamos, toque el bolsillo en un sentido, sabes, que la persona diga, no, yo no voy a pasar por ahí porque son 6.000 pesos. 6.000 pesos, con 6.000 pesos, pues yo creo que se puede subir más allí ese valor para que verdaderamente sea como que la gente diga, no, mejor no paso por ahí, para evitar la congestión, ¿sabes? Esa más como una recomendación. Y bueno, con respecto a lo que tú comentabas, de mirar también, dado que tu propuesta es ambiciosa, mirar la parte de las energías limpias también, porque también hablabas de la polución y esto, creo que se deben incentivar mucho más las energías limpias para el transporte. ¿Vale? Aquí Ivonne está haciendo en paralelo la traducción. Entonces, es una esencia. Gracias.
No, thank you for your comments. It was really valuable for me. Sorry, I understood like half of what you said. My Spanish is not the one. I read this paper actually from Uninorte that looked into when and how much the cost should be for trying to implement a congestion charge. However, it was from 2017, so it might be slightly outdated. So I'm really grateful for your opinions, and I will consider increasing my congestion charge. Thank you. I have a question for you, sorry. For talking about clean energy and how to grow them, would you like me to cost that and include it as part of my proposal, or would you like me to just talk about it at the end?
Okay, I think that maybe consider in the proposal cost. And I think that this is a part of the exercise. Try to do this. So I think that maybe consider some benefits that people would have if they buy clean energy or a electric car, for example, because here in Colombia, people can access to electric cars, but we don't really use electric cars in the way that we maybe can use. I think probably there are some issues related to, but maybe if the people have more benefits, probably they will access more to electric car, for example. So could be an idea, I don't know.
Oh, no, thank you. That was actually really helpful. And I will definitely include that in part of my proposal. Thank you so much.
In London, where there's a congestion charge, electric cars are free.
Free?
Yeah. Hybrid cars also used to be like at a discounted charge or free, but now they're also charged now. So.
And especially in a city like Medellin, that we know that is very recognized internationally, and they have a lot of innovations all the time, trying to do the best things in the country. So I think it would be a good idea. Thank you.
Thank you.
All right, I think we are moving on to the voting. So here we go. Would you fund this initiative? All right, we've got 19, 20 responses. We'll give another 10 seconds. All right, final results. So 25% would fund at 100%, 35% at 50%, and 40% would receive no funding.
Okay. So I think that for today, oh, thank you, Professora Roxana. Bogota, I agree. So Bogota, Medellin, two areas where there's a lot of congestion where proposals like this would be well received. So I think that we had great engagement today. We learned how to move through these business cases, to ask the questions, comments, and then vote on the potentials for funding. And Professor Nicki, I think if we agree that we're coming to a closure for today, but then we will work to see if when we meet again on Friday for our final GBE, that we can resume some of the presentations that were not able to be shared today, as well as we have an activity with Uninorte related to that Carnival and maybe some other cultural experiences. So I think for today, we will be closing. I want to thank everyone for their time. I know that, and I want to leave it open also if Professor Joel, Professor Roxana, or Professor Nicki wants to say anything as we close today for our session.
I want to go ahead, ma'am.
Everyone, I thought that was really useful, and hopefully my students have learned things from everybody else. That's great. I know that some of my students probably won't be able to make it on Friday because of other commitments, but those that will, I'm sure, yeah, again, we'll kind of see if we can crack through them a little bit more quickly so that we have time to do everything else. But thank you for everybody for your input. That's been brilliant. Hope you've been entertained.
Thank you. I want to say that it has been a great learning opportunity for everyone who has attended today. And I believe that we have learned one or two things from the presentations. And I also see that, hope that both students and faculty will have seen a proposal that is fundable and the one that may be challenging. So, and we can learn or take one or two things from that to move forward. Thank you all.
Gracias. Ivonne y todos los profesores, Nicki, Joel, Jessy, todos los estudiantes, de verdad que muchas gracias a los estudiantes de medicina de Exeter por estas presentaciones que nos han permitido interactuar de una manera muy, como decimos acá, chévere, muy graciosa, muy rica, muy dinámica, ¿verdad? Y muy a gusto con todo lo que hemos tenido en el día de hoy. So many thanks to all the Exeter students for these presentations and for this opportunity to share today. Thank you.
Thank you. So our next session, la próxima sección en cual vamos a venir juntos, va a ser este viernes. It will be this Friday, March 25th, and it will be, let's see, we have 3 different time zones. It will be at 11 a.m. to 1 p.m. Eastern. It will be from 10 to 12 time in Colombia, and it will be from 3 to 5 p.m. in the UK. And so your faculty will be sending you the link for that as well. And thank you everyone for your participation. We look forward to seeing everyone back as they're able to on Friday. And thank you everyone. Make sure that I think we're either lunchtime or dinner time. Everyone get a snack and a break. So I know some of us are in clinical, some of us are between classes. So thank you everyone for your time.
Thank you everyone.
Bye-bye.
Bye.
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 Great share.
Bye.
Bye-bye.